Are you or a loved one suffering from Parkinson's disease? Are you taking medications and they work but then they wear off? Or are you taking medications where they're not helping you at all? My name is Dr. Lonnie Herman, and in this video we're going to be talking about how a man who's been suffering from Parkinson's since 2015, right now it's 2019 that I'm making this video, since 2015, and he had various symptoms, which I'll get into in a few minutes. This man took medications and they just they didn't let him feel well. He wasn't feeling good with them. So he wanted to look outside the box and see if something else could help him. And there's incredible improvement that's happening with him that we're going to express. I'm going to read down a long list here of symptoms that he's getting better with under my care. And in a future video, you will see video of him, of his functions and the functions that's gotten better with him. Okay, so I will just want to tell you about myself. I'm a creator of a functional neuro recovery therapy. I went back to school 12 years ago to start with functional neurology studies, and I went through a few hundred hours of that. I went through neurochemistry, neuroimmunology studies, as well as blood chemistry analysis and thyroid hormone analysis and thyroid disease understanding, as well as gastrointestinal disorders, and there were many different laboratories about the GI tract that I would run on patients, which I don't do anymore for a specific reason I'll get to in a moment. I went through movement disorder courses in the neurology program, human brain dissection course that I took with one of the experts in brain dissection. The immunology part of the neuroimmunology and neurochemistry program I took in my postgraduate studies was taught by one of the world's most recognized immunologists, who had shared with us research papers from scientists from labs around the world where these scientists were able to prove that different infections and chemicals would get into the nervous system and cause body parts that make the body malfunction or make the brain malfunction. So the premise that I follow is finding the infections and or chemicals in the brain and removing them from the brain and other tissues so that we can get the body to stop malfunctioning. So before I get into the exam findings here with this gentleman, who is, let's see, his age is, excuse me one second, he is 51 years of age, and he started coming to me. His first visit with me was in January of 2019. He had a second visit in April of 19 and third visit in August of 2019. I'm making this video right now in August of 2019. He had several symptoms that were really bothering him. One is that his left arm was very stiff, would be right by his side, and it just does not move. When we walk, we should have a nice easy stride of the shoulders moving, because the arms and legs have to move opposite than one another in order for us to have balance. One of the basic human functions about the nervous system function as a human being is to have balance when we stand on 2 feet. So he had a very stiff left arm. One of the problems that he noticed was when he drives an 18-wheeler, he delivers goods to different businesses, and he would, for him to get a drink while he's driving for several hours, drink, let's say, a bottle of water in his truck, he could only drive with the right arm because the left arm was so stiff. He couldn't depend on the left arm to hold the steering wheel. And so when he would hold on with the left hand or left arm and he'd reach over to get the bottle of water to take a drink, he'd swerve over into the next lane because he could not control that steering wheel with his left arm. Well, now after two of the protocols that I designed for him through my unique exam process, 2 protocols, he's able to hold on to that steering wheel and not swerve out of the lane. He can hold on to the steering wheel and stay constant in that one lane, which is a big deal for him. He also notices, a very big deal for him, he also notices that when he walks, his arm is no longer as stiff as it was. It's still stiff, but the extreme rigidity that was in that left shoulder is no longer what it was. That's a great thing. He had extreme anxiety. He felt that he was scared out of his mind as a symptom that he expressed. Now he said his anxiety is 20 to 40% decreased than what it was. He had leg twitching that was pretty severe, restless legs. His, I'll say female companion, his significant other, she said that his restless legs were just out of control in bed, and now he doesn't have the restless legs anymore. He had those for a few years. He said that his, which we knew from the first exam when I first interviewed him, his voice, he was losing the strength of his voice, and now after 2 protocols, He has a normal strength in his voice. It's consistent. He can keep that volume up naturally without straining to keep it up all the time throughout the day. He said his balance was poor and he was very slow with movements, and now his balance looks pretty much normal on the last neuro exam I did with him. And his movements, his whole body is able to get up out of a chair better now. He's able to walk with good stride, except for that left shoulder the left arm is still pretty stiff. He also had a problem with getting off the toilet. So standing up from a sitting position was difficult. Now he's getting up from a seated position, which we took him on a low chair in the clinic. From him getting up from a low height of a seat, he was able to get up with basically no challenge, no difficulty at all. He had a drop foot with his left foot, and now that one is just about 100% recovered from the drop foot. His left leg was sort of, along with that left shoulder, his left hip was restricted to where he had a drag of that left leg, so to speak. It was lagging behind, let's say, and now he doesn't have that lagging behind of the left leg. He had burning in the feet, and now it's nearly 100% gone. He also had tingling in his legs. That's, last he told me he can't remember the last time it occurred, so we're going to consider that 100% gone. And when he would stand, when I first met him in January, when he would walk in a direction, have to turn around and come back, he'd freeze. It'd be a very slow stepping to turn around to come back in that opposite direction. He doesn't have that freezing anymore. He's very quick. He's able to turn around pretty easily. And he also had told me that, what was that? Was the other one? He could ride he can ride his motorcycle for 60 miles with no challenge. Before this, back in November, it was extreme difficulty. He told me in November it was the last time he could ride that motorcycle, only because he had to start it up to burn some fuel, so the fuel and the pipelines, or so the fuel lines would not get like stagnant. I'm sorry, I'm not a motorcycle person, but he found that he's able to ride his motorcycle with ease. He's not veering from one lane to another. He can keep it straight and constant, even with the left hand. And also he dresses himself easily. He can dress himself. He can button shirts easily. And as well, his significant other said that he can open and close the drawers of the dresser with no problem with either his left or his right hand. He's got no more challenge with that. So let's understand what allowed him to get to this point. Now, if you want to believe in the dopamine deficiency scenario that the drug companies are saying that you have, and the Parkinson's groups are saying that you have, you can believe that if you want. And if you want to be able to donate money to those causes, it's your right to do so. And if you want to continue to just take those medications, it's your right to do so. If you want to start thinking out of the box and understand that there are different kinds of disease-causing infections and toxins that may be hidden in your brain and in other parts of your central nervous system, and even some organs, that are causing your body to be so stressed that it can't function normally, you have a right to believe that too. And I'm here to tell you that that's the reality. If you look up research, for example, like the West Nile virus, you can get bitten by a mosquito, even in the United States, even in Canada, even in Europe, even in South America, even in anywhere in the world, you can get bitten by a mosquito and get the West Nile virus, and then all of a sudden your body over the next day or weeks or months can become rigid or even get a tremor. And we'll put up some research about that here next to me, okay? There are different viruses that can do it to you. And you wouldn't even know you got it because you don't have to have a flu-like cold or coughing sensation or fever. That doesn't have to happen. And there are studies where they did in different countries where people were functioning normally before they went on vacation, and they all of a sudden, while they were on vacation, where they developed a fever and then tremors started, and where they did a spinal tap and the person had a virus like West Nile virus, or they had a parasite like malaria that was in their spinal fluid, and it caused the central nervous system function, depression of the central nervous system. So in his first examination, let me, even before I get there, excuse me, one more point. When I took my neurochemistry program and the postgraduate studies that I did, in the fifth part of that program, I remember really clearly, this one professor, he was a functional neurologist, he stood up and he said, that, you know, we can try to mimic dopamine by giving different nutrients that would do it, like mucuna. I tried that, it didn't work with patients, but we could try to mimic it and try to give a vitamin or an herb that's supposed to be able to do the job instead of the medication. You said, but they're already getting medicated and they're already trying to mimic the dopamine, for example, in Parkinson's, trying to mimic that as well. Why try to mimic it? Why don't you find why? If you can find why that the body would not be able to, let's say it is a dopamine deficiency, and that you could find out why the dopamine wouldn't be made. Wouldn't that be a greater deal for the person? Wouldn't you make a greater impact on the person's health? Because if we could find what it is and help them get rid of what it is, that would make a big difference. So before I get into these other findings, I told you about like a virus getting in the brain. Well, let's look at another video I'll put up here now of what in the University of Calgary in Canada, what the scientists did was they took snail brain tissue. They said that snail brain tissue closely resembles human nerve or human brain tissue. They put that in a petri dish. They watched it for several days. They watched it grow. They watched it form new connections. And then they exposed it to mercury, like the dental mercury that's in so many people's teeth. They put that dental amalgam mercury on the petri dish, just a tiny amount of it, like the size of a pinhead. They put it in the petri dish for about 20 minutes near the snail brain tissue, and it retracted. It became diseased. It actually shrunk. It atrophied. It denuded the neurofibril is the terminology. You'll see that, and I'll be right back.
How mercury causes brain neuron degeneration. Mercury has long been known to be a potent neurotoxic substance, whether it is inhaled or consumed in the diet as a food contaminant. Over the past 15 years, medical research laboratories have established that dental amalgam tooth fillings are a major contributor to mercury body burden. In 1997, a team of research scientists demonstrated that mercury vapor inhalation by animals produced a molecular lesion in brain protein metabolism, which was similar to a lesion seen in 80% of Alzheimer-diseased brains. Recently completed experiments by scientists at the University of Calgary's Faculty of Medicine now reveal, with direct visual evidence from brain neuron tissue cultures, how mercury ions actually alter the cell membrane structure of developing neurons. In this experiment, neurons also isolated from snail brain tissue were grown in culture for several days, after which very low concentrations of mercury were added to the culture medium for 20 minutes. Over the next 30 minutes, the neurite membrane underwent rapid degeneration, leaving behind the denuded neurofibrils seen here.
So that's proof right there that mercury can cause neurodegeneration. And here's another one. I'm going to show you this brief video of what happened in this island in Japan called Minamata, and it's known as Minamata disease. These people develop seizure-like symptoms and tremors, movement disorders, because of a mercury poisoning that got in their system. Because of the mercury that poisoned the fish, they ate the fish, they got poisoned by mercury. It was proven in the research that was done in Japan. And let's watch this one, and I'll be right back again.
In 1908, Shin Nippon Chiso built a factory in Minamata, a small fishing village in Kumamoto, Kyushu. The company manufactured nitrogenous fertilizers and soon became the major industry in Minamata. By the mid-1950s, Shin Nippon Chiso had become the industry leader in its field. In 1954, the Sanitation Office of Minamata City began receiving reports of an unknown epilepsy-like affliction, which has since become known as Minamata disease. Since the cause of the disease had not been identified, patients were isolated to prevent spread of the disease. Minamata disease is a neurological condition. Mercury poisons the central nervous system, damages the sense of balance and motor skills, which leads to increasingly intense body convulsions and ultimately death. In 1957, the Minamata Disease Research Group of Kumamoto University announced that Minamata disease is a toxic disorder of the central nervous system caused by certain organic mercury compounds transmitted through the intake of seafood. They isolated organic mercury as the sole cause through a series of experiments on cats. In the same year, extremely toxic levels of organic mercury were detected in the human patients. The report submitted to the Ministry of Health and Welfare stated that the underlying cause was organic mercury in seafood, and the wastewater discharge from the factory was suspected. Afflicted patients continued to be found until 1960. A rash of babies were born with brain damage and extreme physical disabilities.
So that's incredible. Look at what happened with those people. You could see easily they had movement disorders all caused by mercury. You saw before I showed you that there's denuded neurofibrils because of a mercury poisoning that was right near that snail brain tissue. And you also saw research that I showed you that people can have tremors, can have shakiness in the body because of viruses, because of parasites. Now I'm going to point out one more thing. There is also research I'll show you here now where the movement disorders happened during surgery when they gave people sedation chemicals and gave them anesthesia chemicals to sedate them and knock them out to do a procedure. And we need that because nobody's going to have an open heart surgery or have whatever surgery is going to be done on them. I'm glad that we can do surgery and save somebody's life, but understand that the side effect can be a movement disorder. It can be athetoid movements, strange writhing movements with a body part that's uncontrollable. It can be tremors, it can be stiffness, rigidity, it can be dizziness, it can be a low heart rate, it can be nausea that's constant because these chemicals get in and stay in the tissues of the brain and the body and make the body malfunction. So if you could just imagine for a moment, if you put dye in this shirt, the dye will be there forever, it doesn't come out. No matter how many times you wash it, it's not going to come out. So think of that dye getting in that shirt like a chemical from a surgery, whether it's a dental procedure where they inject numbing agent into the mouth that can go in the brain and change the brain function. Change it and stay there. They give you a sedative, they give you an anesthesia chemical for surgery. It can go in the brain and stay there. With this unique system that I practice, I believe I can find that and get it out of you and see the improvements like this man is experiencing right now. So in January, his first exam, I found that his cerebral spinal fluid, the fluid in and around the brain and spinal cord and brain stem, he had mercury in there, and he also had Roundup weed killer spray in that fluid, and he had a bacteria called Legionella bacteria in that fluid. Any chemical, any infection getting in that cerebral spinal fluid will get into the brain and the spinal cord and the cerebellum and the brain stem and cause you to have malfunction, any kind of malfunction, whether it's a tremor, a mood disorder, a digestive problem, a heart rate problem, can all happen from central nervous system depression, from chemicals and infections that get in that fluid. I also found that he had dental mercury residues in his kidneys. I found his small intestine, he had the midazolam sedative chemical, which can lead to tremors, and propofol general anesthetic from a surgery he had done in the past that can lead to tremors and movement and rigidity disorders in his small intestine. The intestines absorb chemicals and they can stay in there, which won't show up in a stool test. I used to run so many stool tests on patients to look for different things in them, and there were too many times that patients would have stool tests that came back negative. There was no infection, and they didn't even look for midazolam or didn't look for propofol. I'm not knocking the drug companies, folks. I'm not saying the drug company is a bad company. I'm saying that we need those chemicals for these surgeries. We need them for certain procedures, but you've got to think of the impact that those chemicals will make on your tissues and how it can cause something else down the road to develop in you, some disease, some malfunction in your body. I also found that he had a hookworm in the stomach. He also had, with getting back to the nervous system, he had Legionella bacteria in a part of the brainstem called the red nucleus. The red nucleus helps you control motor functions of your limbs. The red nucleus is a part of your upper brainstem, And that helps you control motor function to parts of your body, including your arms and legs and your shoulders. The red nucleus actually is known as the helping the body have the arm swing when we're walking in particular. So the Legionella bacteria in the red nucleus. There's a part of the brain called the basal ganglia that's also helping us move smoothly. He had the Legionella bacteria there as well. I found also that in arteries that bring blood to the brain, like the vertebral artery that's in the cervical or neck spine that goes into the back of the brain and the cerebellum, the vertebral artery, neck, spine, and the back of the spinal cord area, not the throat area where the carotids are. Vertebral arteries in the back, they go up to the cerebellum and parts of the brainstem and parts of the back of the brain. He had Legionella bacteria there as well, and in the cerebral arteries, the carotid arteries as well. And also in that first exam, I found that he had dental mercury in his white matter of the central nervous system. What does the white matter do? The white matter helps you move body parts. Now, when he came back in April, after that first protocol, he was able to stand and turn without freezing. He noticed that his burning pain in his feet was 50% better, less intense and less frequent. It's even better now. His pins and needles was 70% improved after that one protocol. His stuttering that he had, that was another problem. His stuttering had decreased but not gone. Now there's no more stuttering. His anxiety was an 8. Now it's down to maybe, then it was down to about a 7 or a 5. So he was like 10%, 20% better. Now he's 20 to 40% better with the anxiety. The scared out of the mind feeling was decreased then. Now it's totally gone. His leg twitching or restless legs was less severe, less frequent, but now it's totally gone. His voice still came and went of the volume, being able to regulate the speech volume. Now he's got consistent strength, but he was getting better at that point after that first protocol. And his left hand was able to start coordinating with a button, like buttoning a shirt wasn't perfect yet. And getting off the toilet was only about 15 to 20% better after that first protocol. Now he's getting off of there easily, with no challenge. And the left foot drop after that first protocol, he was about 30% improved, which now there is no more of that foot drop. Now, in April, when I re-examined him, here's some more findings. I found that a weak tissue in him was the arteries that bring blood into the brain. He had the varicella virus and the polio virus stressing those cerebral arteries. So there's going to be an immune reaction against those arteries that feed blood to a big part of the whole brain. I won't say the big part, let me just say the majority of the cortex of the brain, where we have what's called the homunculus, which means that we're able to we have a map of the body in this cortex of the brain. The varicella virus and the polio virus were there, and his immune system is going to act against those viruses in those arteries, and that will impair brain function, and that can interfere with dopamine transmission. So let's say there's enough dopamine made, but the receiving site, let's say it's inflamed and numb so it can't feel. It's like a quarterback throwing a football to the wide receiver, and the wide receiver's hands are numb because they injected the numbing agent for the teeth. They put it into the fingertips and the hand. Can't feel the ball. How's it going to catch the ball? So imagine that you have receptor sites for dopamine that can't receive the dopamine if the dopamine is made normally. And they probably have never done a dopamine biopsy of a tissue in your brain, and so they know you have decreased dopamine in different sections of the brain. And even if they ran a DAT scan of your brain, they can't tell that you have decreased dopamine. They're going to say it seems like as if it's a possible Parkinson's or dopamine loss. But that's looking at temperature changes in the brain. They can't make a definitive. It's never written as exact, at least from the studies I've read, as an exact outcome from that DAT scan. So you can have a temperature change in the brain because you got a virus in the brain. You could have a temperature change in the brain that shows up in the DAT scan on Monday and Tuesday. If you run them 2 days in a row, you might have a change from day 1 to day 2, from Monday to Tuesday, from the first of the month to the second of the month, because maybe day 1 you were happy and everything was great in life, and day 2 you woke up and you had you almost had a car accident on the way to get the DAT scan done, and your heart's palpitating, temperature, pressure changes in the brain from that anxiety, from that stress of almost having a car accident or having a fight with someone, an argument, and then your DAT scan is going to look different after that on day 2. I also found that his spinal cord in this April exam, I believe he had the parasite from the malarial infection. Malarial infection, yes, parasitic infection can come from that, from mosquito bites. You get a mosquito bite. When was the last time you ever caught a mosquito and sent it to a laboratory before or after it bit you and said, tell me which infections were in that mosquito that it could have given me or that it did give me? I doubt you ever did that. His red nucleus had the varicella virus. His cortex of her brain had the parasite from the malaria and the varicella virus stressing it. The frontal lobe of his brain that also helps to facilitate arm and leg function, as well as cognitive function, as well as other body part control. Dental mercury. His parietal lobe in his brain had the dental mercury. His thalamus of his brain. The thalamus helps to send signals to the brain. It's in the brain, sends signals to the cortex of the brain, where those motor neurons can control your arm and hand or leg and foot. His thalamus, he had the tetanus bacteria. Tetanus is known to cause rigidity in the body. His white matter of his nervous system and his cerebellum, and his dura layer of his meninges, and his vertebral artery, and his spleen, and his spinal fluid, and his basilar artery, and the hippocampus of his brain, and the basal ganglia, and the substantia nigra, and his amygdala. I just showed off several tissues. They were all, I believe, through the testing that I performed, infected with the tetanus bacteria. Well, how did he get tetanus? Maybe when he had a tetanus shot years ago, it gave him tetanus, and that went up there into these different tissues and spread over the years to these tissues. Again, tetanus in the thalamus of the brain, white matter of the central nervous system, which is in the brain and the brainstem and the spinal cord, the cerebellum, the dura layer of his meninges, the vertebral arteries, the spleen, the spinal fluid, the basilar artery, the hippocampus, memory center of the brain, and the basal ganglia, and the substantia nigra, which is a big dopamine production center in the brain, and his amygdala. Amygdala stress can cause anxiety. Amygdala stress can also make different symptoms in the extremities occur. Different symptoms can occur. You can have shakiness. If you got anxious, do you get shaky in the hand? Do you feel like shaking because you're nervous, or you almost, some serious trauma or a possible trauma would have happened? Maybe somebody's going to attack you, you walk up, I don't feel right, because the amygdala is all wound up from that stress, and that makes you shake. Well, the tremor, same kind of thing. I know it's more severe than saying I got stressed and I calmed back down afterwards, but just understand the physical manifestation of anxiety can actually lead to a shaking in the body, a feeling of a trembling inside. So understand that the amygdala also can be stressed by infection and/or toxin and make a shaking experience of a tremor movement disorder in the body. Definitely. So when he came back after that protocol in April, even better. He's able to get up easy. He's feeling more less rigidity in that left shoulder. He's able to drive his truck with the left hand without swerving out of lane in that truck. He's able to ride his motorcycle for 60 miles without any fear. His anxiety is decreased 20 to 40%. His speech volume is up. His left leg doesn't feel like it's dragging. He's so much better now, so much better. Restless legs no more. He can button his shirts by himself. He can get dressed by himself, undress by himself. His significant other, his lovely, she notices a great difference in him. So in this third round was in August 19th, I saw him, and I'll see him again in 100 days. So that should be around, let's say, November sometime, give or take, maybe November, December. The diencephalon of the brain I figured out from my exam. His diencephalon, which is an internal part of the brain, first formed when you were an embryo in about week 2 or week 3 of embryo development. Tick-borne encephalitis virus, stressing the diencephalon. And it's involved with dopamine, and it's involved with movements of the body. It's involved with brain function. It's involved with motor systems in the brain to the body and the body to the brain. The diencephalon is very important in brain function. The diencephalon in embryo development is one of the first parts of the brain to form that actually help the whole brain to create the brain and the body from embryo seed on. If you think of this analogy, you have a big apple tree that's been around for 30 years. It all started from a little seed, like the embryo. Every part, every fiber of that tree, the seed is throughout the entire tree. The diencephalon helped to create your whole brain and body. It was one of the first parts of the embryo that formed. The diencephalon is still there in your brain, doing a lot of work for you to regulate brain and body function. When it's infected, when it's toxic, it can cause malfunctions in brain function and body function and chemical production in the brain. His diencephalon, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12 different stressors I'll mention, and also his amygdala had several different ones. His amygdala had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23 different issues, and his ears had infection, we'll get into in a minute, and his kidneys still had some stress in them. And when kidneys are stressed by infection, they can actually just make a rigidity in the leg and the hip and the pelvis occur. So his diencephalon again. tick-borne encephalitis virus, California encephalitis virus, Colorado tick fever virus, chikungunya virus, Zika virus, lymphocytic choriomeningitis virus, parvovirus, Sinbis virus, influenza virus, human foamy virus, simian virus, and he had lidocaine. Lidocaine chemical from dental work was in that diencephalon, impairing its function. Think about this. When you have dental work done and they put that needle in the mouth to numb your mouth, what happens? Your mouth is numb, you don't feel them doing the work, you know it's there, you hear the drill, you can feel them pulling, but you don't feel the pain. When they tell you to rinse your mouth out, they give you a cup of water and rinse your mouth out, when you put that water in your mouth, squish it around, your mouth is impaired. You don't feel it right, your motor control has decreased. When you go to spit it, you're probably drooling on yourself and trying to spit it out in that sink or dish next to you. You can't target properly when you're trying to spit because the motor control of the jaw muscles and the tongue and the lips are impaired from that sensory decreaser. So the lidocaine local anesthetic numbing agent impairs sensory and motor. Just imagine what it's doing when it now got up into the brain. Because listen to this. Where do you think that it went when it wore off 3, 4, 5 hours later and you could drink, eat, and speak and swallow normally? Where do you think that chemical went? Where'd it go? Did it just disappear? Did it go into thin air? Did you pee it out? Do you think you sweat it out? Did you breathe it out? Or did it spread to other tissues also? Some of it left your body, but some of it stayed in there. You know, if you took a white t-shirt, think about this analogy for a minute. Take a white t-shirt, go to your bathtub, put the stopper at the drain, fill it up with water, put some blue dye in there. Take a white t-shirt, put it in underneath for, let's say, a minute. Take it out and hold it there. You're going to see water with the dye, blue water dripping off of that shirt. Not all that dye is going to stay. Now, the shirt is going to be dyed blue, but some of that dye is going to drip out. Leave it hanging in the shower, let the water out of the tub, wash off the tub so there's no stain in the tub from the dye, but let that shirt drip out. Some of the dye is going to come out. Dry, 2 days later, put it on, wear it, put it in the washer and dryer. Do that about 10 times. Some more dye is going to come out, but not all of it. So when some of that lidocaine numbing agent came out of the body, not all of it, his amygdala, he had chikungunya virus, human foamy virus, lymphocytic choriomeningitis virus, black mold, and West Nile virus, and treponema bacteria. He also had dental mercury and tetanus and parasite from malaria affecting that amygdala, and remedies are provided to get rid of those stresses. I expect him to be moving a lot better and functioning a lot better when I see him again, which will be, as I said, maybe around December of 2019. I believe he had various bacteria and viruses, influenza virus and some fungus and staph bacteria in the ear canal. Now the ear is really important because the ear helps us to coordinate balance. The ear canal helps us coordinate balance. The ears and the cerebellum and the peripheral nerves in the feet and a couple of parts of the brain, in addition to the cerebellum, help us coordinate balance. The ears are important in coordinating balance. Understand that in order for us to be balanced as humans when we walk, when the right leg moves forward, when the left leg moves forward, the opposite arm. Right leg, opposite arm. So left leg forward, right arm forward, right leg forward, left arm forward. It's always like this, okay? What happens when the ear canal can be infected? It can cause you to lose your balance, but it can also cause rigidity in a limb because your body is compensating to a certain degree for that ear infection. Even though the ear doesn't hurt, it doesn't have to hurt. You don't have to lose your hearing from the ear infection. You can have impaired motor functions from that. So I'll see him again very soon. First of all, I want to thank you for watching this because I know you're listening to me, and either you've been following me for some time so you know about the positive changes I'm making for people and the amount of different information I can give you, or maybe you're just finding me now and you've never heard of me before, you don't know who I am, and you're saying, well, this sounds good, but who is this? Let me look up some information about Dr. Herman. I'm going to tell you, there are people out there who don't know what to believe, who have never met with me, who believe that they know it all, even though they're not doctors, and they are looking around for answers, and they want to believe whatever they can. They're not doing well. But they can write stories, they can write things, and they could say, well, he's this or he's that, he's this kind of doctor, that kind of doctor, but they've never been here. They haven't been, they don't know. So with that said, you deserve to get well. You deserve to get well. You can get well. You can improve. Watch other of my videos about Parkinson's on my YouTube channel, about essential tremors also. You'll see proof right there in the videos. Let's actually show you a brief excerpt of a tremor video right now with a patient, and you'll see his hand shaking to no shaking when he held his hands up in front of him. You're going to see that. It's real. And also you'll see other videos of other people being able to walk and swing in their arms and running. You're going to see changes here. It's happening. It's really, really happening. And these are not paid actors. These are real people speaking on their behalf with me about how much better they're getting under my care. Okay? I'm not here to cure Parkinson's. I don't think Parkinson's will ever be cured because you shouldn't treat the disease. It's not the disease that has to be treated. It's finding the hidden causes of the disease so you can get rid of those so the body can finally take a deep breath and relax, so to speak, and relax and be able to function normally again. And that's the reality. That's the reality. So you can like me on my Facebook page and follow some other posts I put up. I get into some detail about these different conditions and showing positive feedback from patients on there. You can also follow me on my Instagram page as well, and subscribe to my YouTube channel. So when you go to subscribe on the YouTube channel, you can actually and turn the bell for notifications. So Google or YouTube will email you when I put up a new video, so you can be the first to hear from me. You'll get an email that says, Dr. Herman put up a new video about, whatever the condition is that I'm talking about in that video. So it's great for you to be able to get messages from Google. That way you know when I put a video up, so you can stay abreast of the other positive changes. Even if you're not ready now to come here because you're not sure yet, then watch other videos on my YouTube channel. I put up a lot of great ones there, and go back to your doctor and ask them about the things that I've talked about. Let them say whatever they want, but are they really, really helping you? And after a while, maybe it'll take you a year, maybe it'll take you a couple of years to be able to decide to come in here. And that's right. You have your time. You have your time. You have your chance. Whenever you want. Okay? I'll still be here doing this great work for people. I do want to tell you though, 23 years ago, my grandmother's second husband was diagnosed with Parkinson's. He was a great man. He took care of my grandmother really well. He was nice, he was calm, he was loving, he was a retired attorney. He did well financially in his life. He treated my grandmother like a queen, not spoiling to a great degree, but he took care of her really well. They traveled around the world. It was like a second, high school love affair kind of thing. They were just great together. He was such a great person. I really loved him. He treated her great. But 23 years ago, he was diagnosed with Parkinson's. 3 years later, with the medications, with the doctor visits, he passed. He passed because of Parkinson's. He passed because the medications didn't help him. He passed because we watched as his brain failed. He became emaciated. He couldn't feed himself anymore. She fed him. She took care of him. They tried. He couldn't get up out of a chair. He couldn't walk. He couldn't wipe himself. He couldn't wash himself. He couldn't brush his teeth. He couldn't dress himself. He became so frozen, he couldn't even make facial expressions. He couldn't even speak anymore at the end. And that really put me on a mission back then of opening my mind and being able to look for the research out there and see, why was it that it failed him? Why did that system fail him? When the best doctors, he had top doctors, top neurologists in the top hospital here in Florida, seeing him and caring for him. And he was scared. He was scared because he knew that the medications he were taking were not helping him. And he told me, I'm scared. And I wanted to figure it out, but we didn't know what to do back then. There's a lot more research now than 20, 21, 22, 23 years ago. Now, with that said, the doctors, when we went to those doctors with him, the doctor said, you can up the medications and that's it. We don't know what causes this. We don't know what else to do. Basically is how it was. We've got these meds and that was it. So they gave him speech therapy, occupational therapy, physical therapy, and one visit with a nutritionist, and upped the meds and changed the meds. But it failed him. It failed him. We lost him. 20 years ago, we lost him. And it was unfortunate because, my grandmother, number one, it was alone again. But two, because he was such a great guy. He had so much that he achieved in life, and it was taken so soon from him. His life was taken so soon. And it was really terrible. So if the medicine was the right way, and if the medical science out there was the right and the only way, how did it take his life so quickly? How? All right. So I believe from my studies in neurology and neurochemistry and neuroimmunology and other things that I've gone through, other subjects that I've studied, constantly studying and looking for answers out there, I believe that I've got a very unique and effective and safe method to help you get well, a unique set of skills and tools. I will tell you, I'm not here to take you off your Parkinson's med. It'd be your decision and/or your doctor's when you start getting better, and you can, to start decreasing those meds on your own. It's your decision and theirs with you. Now, with that said, again, you can like me on Facebook, you can follow me on Instagram, subscribe on my YouTube channel, call my clinic when you're ready to make an appointment. The number here is 954-370-3100. That's 954-370-3100. And you can also send an email if you wish, if you're coming from out of the country, as many people do come to my clinic from out of this country. The clinic email address I'll put up here as well. My assistant can help you make appointments here for your first investigation consultation appointment, which would be totally different than what you've ever gone through with a doctor. Totally different, not a regular consult appointment. I am going to want records, any blood tests, any MRIs, anything that was ever done in the recent time that you've been diagnosed with your Parkinson's or movement disorder or tremor disorder. I'd like to see those results as well, okay? Furthermore, the exam does have to be done here in person. It is about a 2.5 hour visit here, and we'll send you the protocol. The average protocol you're going to follow is about 2 to 3 months in length. That's average, not guaranteed, but average. You might have dental work that we have to assess. I do a very unique dental examination. You may have dental work that we've got to clear, get done with. Root canals. Watch this video I'll put up here about root canals and how they can actually cause different disease in the body. Just go to that video. You'll see it. I'll put up the thumbnail now, and you go to that and watch that video too. It's amazing what I'm finding here, and very interesting and different than probably what your doctors are telling you. And even your dentist tells you about teeth. So we may have to get you involved with a dentist. I've got a dentist here who does work for me and with me. He's about 20 minutes from my clinic, and it can help us clear out these different infections and chemicals from your teeth. But even that alone is not going to fix you in many cases. So it's a combination that we've got to solve. Okay, it's a riddle, it's a puzzle that we've got to solve for you. So with that said, insurance does not cover this. They don't recognize my kind of work. I wish they would, but they don't. Now, it will be out of pocket. It is an investment in yourself. You call my clinic, she'll go over the fees with you, okay, and help you arrange appointments with me. She's not going to be able to tell you how I do what I do. I can get into that with you privately, okay? So beyond that, when you're ready to make an appointment, you give us a call or send an email, and we're happy to help you. On average, we're about a 2-month waiting list for our appointments, for exam appointments in here, okay? So I really want to thank you for watching this. I hope this was helpful for you. And if it was beneficial, please do share this with someone.